Hospital system mega merger is officially off tonight. Both Minnesota-based Fairview Health and South Dakota-based Sanford Health say they have backed out of the deal. That's after months of backlash from patients and an ongoing investigation of the deal by the Minnesota Attorney General. Danny Spiewak is here to explain what happened and what it means for you. Danny?
Marina, this is the second time in a decade that a proposed merger between Sanford and Fairview has failed. After months of delays, both health systems said they faced too much opposition to get this deal done.
Last year, Sanford Health and Fairview Health Services proposed a merger that would have created one of the largest healthcare systems in the nation.
This merger is about doing more for those we serve.
But the plan drew concern from Attorney General Keith Ellison and the University of Minnesota. The U was especially worried because they sold their medical center to Fairview in 1997, and a merger meant a company based in South Dakota would control their teaching hospital.
We cannot have an out-of-state entity owning the facilities that decide the health and well-being of Minnesotans.
On Thursday, the merger talks officially ended. Fairview released a statement saying they discontinued the merger talks because they lack support from certain stakeholders. Meanwhile, Sanford says they made the decision to end talks for the same reason.
And yet they both didn't want to be with each other.
Alan Baumgarten is an independent analyst of the healthcare market.
Are you surprised that Sanford and Fairview have ended the merger talks?
Given the fact that I never thought it had more than a 50-50 chance of succeeding in the first place, no, I'm not surprised.
In response to the proposed merger, the U of M had unveiled a plan to buy back its medical center. The school asked the state legislature for nearly $1 billion to do it, but didn't get the money.
I think it was an issue on both sides. You could cut the University of Minnesota loose, but that removes about 40% of the hospital revenues from the Fairview system.
In a statement, the U says it remains focused on their public mission to provide high-quality health care. Attorney General Ellison, meanwhile, said although the merger isn't moving forward, more work remains to be done on health care across the state.
And just to show how much public interest there was in this proposed merger, AG Ellison says his office received more than 6,000 comments from people in Minnesota about the plan. His office also reviewed more than 300,000 pages of documents during the course of the investigation. Marina.
A lot of people interested in that one. All right. Thank you, Danny.